Hello, good evening, everyone. Uh, Thank you for joining us. We'll begin in just 2 minutes. तो अगर आपके कोई भी क्वेश्चंस हो, कोई क्वेरीज हो, तो आप कमेंट करके पूछ सकते हैं या फिर आपके नीचे स्क्रीन पे ये क्वेश्चन मार्क का सिंबल होगा, उस पर भी आप क्वेश्चन पूछ सकते हैं. So Dr. Fayaz will join us in 2 minutes. Hello, Ankit sir. सो आई होप हमारा जो लास्ट सेशन हुआ था डॉक्टर उमेश वाधवानी सर के साथ, आपने उसे भी देखा होगा और आप लोगों ने कुछ सीखा होगा. सो इफ़ यू हैव like any queries you can ask today also in this interactive session, because Dr. Faiyaz Khan is a very good clinician, is a pain science expert. He even has his own school of pain science where he teaches everyone about pain and how it really affects the human body and how you can treat it without going into, or how you can treat it in combination with the scientific principles. And also he's the founder of the Cure Center, where he's treating many patients, sports neuro ortho cases, and with good results. And with whom, like, I have conducted some webinars also and workshops on manual therapy. So as soon as he joins, we'll start. Dr. Faiyaz Khan is here now.
Good evening, Bilal. Good evening.
Good evening, sir.
And a happy winter to everybody,
कैसे हैं
especially
आप?
in people in North India and east of India. झारखंड, पटना, बिहार,
जी सर, उस तक तो
उड़ीसा,
विंटर ज़्यादा जल्दी आ ही
बहुत
जाता है.
जल्दी. उड़ीसा, झारखंड, रांची में 5 डिग्री जा चुका है. झारखंड में और बिहार के कुछ शहरों में 5 डिग्री 6 डिग्री. नॉर्थ इंडिया में भी काफी हाई.
कुछ दिन में तो दिल्ली में अंधेरा छाने वाला है. आई थिंक दिल्ली तो पूरा अंधेरे से भर जाएगा.
ट्रू.
चलिए सर, थैंक यू फॉर ज्वाइनिंग. आपका इंट्रोडक्शन मैंने ऑलरेडी दे दिया है इन सबको.
Oh, then I missed my introduction. How was it?
ये तो हमारे व्यूअर्स ही बताएंगे.
मेरा वीडियो क्या बहुत अटक रहा है. इज इट स्टकिंग इन बिटवीन? क्योंकि काफी लग रहा है कि काफी शेकी हो रहा है मेरा वीडियो. खुद का ही वीडियो मुझे काफी
थोड़ा सा
शेकी लग रहा है.
या
I think
ये सब ब्लर भी है
blur
थोड़ा.
है. So I think there is a significant network issue मेरे यहाँ से, from my end. So am I loud enough?
Yes sir, we can clearly hear you, loud and clear.
ठीक.
So sir, I think we can start now because the rest will join soon. So
Sure. So today's actually we are having, or we are following World Diabetes Day throughout this month. As we can see, different organizations are conducting awareness program related to diabetes education among the common mass, including also the healthcare providers, so that we can easily deal with diabetes and make our patients and people who are suffering from diabetes understand the problem of diabetes. Because without understanding thorough basic primary knowledge regarding diabetes, it really becomes a very problem and a trouble for people to manage diabetes, because it's a lifelong fight and battle. because we all know that diabetes can't be cured. It's one of the incurable diseases. It can be controlled. Rather, it can also be reversed up to huge extent, but it cannot be cured. So, Bilal, how should I proceed? Is it going to be a lecture kind of thing, or you will be throwing some questions? How is it?
First, whatever knowledge you have, you can share with us at the lecture form. Then at the end, we'll be taking some questions from audience, and then we can discuss on that.
Good. Sounds good. So I'll be summarizing the topic of diabetes, and I will be focusing on the common people. Okay, I won't be specifically
Yes, sir, definitely.
dedicating for clinicians or healthcare providers. It will be basically for common people, so that आसान शब्दों में, आसान भाषा में वो हर कोई समझ पाए, including healthcare providers. So diabetes, जिसको हिंदी में मधुमेह बोलते हैं, डायबिटीज इज अ लाइफ लॉन्ग क्रॉनिक डिजीज जो कि अफेक्ट करता है हमारे बॉडी के ग्लूकोज मेटाबॉलिज्म को और या ग्लूकोज एब्जॉर्प्शन को. तो जब भी हमारे दिमाग में डायबिटीज शब्द आता है तो हम एक ही चीज जवाब देते हैं, हाई ब्लड शुगर, है ना. इवन हेल्थ केयर प्रोवाइडर्स आर स्टक विद दिस क्विक रैपिड instantaneous spontaneous answer where they say diabetes is high blood sugar, but they are somewhere wrong. Actually, diabetes is where the high blood sugar is a manifestation of a problem that lies deep down under the pancreas, which is the endocrine organ in human. प्रॉब्लम पैनक्रियास में है, जिसके वजह से एक प्रॉब्लम आता है जिसका क्लिनिकल फिजियोलॉजिकल मैनिफेस्टेशन है हाई ब्लड शुगर. हाई ब्लड शुगर इज अलोन और कंप्लीटली नॉट डायबिटीज इन इट्स ओन सेल्फ. ठीक है, होता क्या है डायबिटीज में, पैनक्रियास में जो प्रॉब्लम है वो क्या होता है, वी अंडरस्टैंड इन अ वेरी ब्रीफ एंड कंसाइज वे. बॉडी हमारे पैनक्रियास में इंसुलिन जो हार्मोन है, जो हर कोई इससे वाकिफ है, एवरीबॉडी इज अवेयर ऑफ द वर्ड इंसुलिन, 24 घंटा हर रोज सिक्रीट होता है हर इंसान के बॉडी से. कितना यूनिट सिक्रीट होता है, 20 से 40 इंटरनेशनल यूनिट इंसुलिन डेली सिक्रीट होता है. जब ये इंसुलिन सिक्रीट होने का जो क्षमता है, द कैपेसिटी इज स्टॉप्ड, और insulin secretion is okay, but the ability of the body to absorb insulin gets compromised or damaged, then we call it a diabetes, or we call it a problem of diabetes. इंसुलिन सिक्रीट क्यों होता है, करता क्या है, अगर ये हम चट से फट से समझ ले. इंसुलिन सिक्रीट करने के बाद हमारे शरीर में जो ताकत का जो रिजर्वायर है, जो फ्यूल है, जो पेट्रोल है, वो है शुगर. कुछ भी आप खाओ वो अल्टीमेटली तब्दील होगा, दैट विल गेट कन्वर्टेड इनटू शुगर. व्हाई? टू गिव यू एनर्जी, टू कीप यू अलाइव. ठीक है, आवर ब्रेन रिक्वायर 6 ग्राम ऑफ शुगर और 6 ग्राम ऑफ कार्बोहाइड्रेट रादर पर आवर. हर 1 घंटे में हमारा ब्रेन को 6 ग्राम्स ऑफ शुगर चाहिए या कार्बोहाइड्रेट चाहिए टू कीप अस ब्रेन अलाइव. अदरवाइज आवर ब्रेन विल गो टू हाइपोग्लाइसेमिक कोमा स्टेट, जिसकी वजह से ब्रेन डेड हो जाएगा, इंसान मर जाएगा. तो जब वो इंसुलिन का जो कैपेसिटी कमजोर हो जाता है टू कन्वर्ट ग्लूकोज और टू एब्जॉर्ब ग्लूकोज, टू कन्वर्ट इट टू एनर्जी, तो वो ग्लूकोज या शुगर हमारे बॉडी में एनर्जी नहीं बन के वो हमारे खून में, हमारे ब्लड सर्कुलेशन में वो घूमता रहता है, जिसकी वजह से हाई ब्लड शुगर ब्लड लेवल या ब्लड टेस्ट करने से समझ में आता है. ठीक है, ये कंसाइज, ये समझ में आया बात कि डायबिटीज होता क्या है. ठीक है, तो इट्स अ प्रॉब्लम ऑफ द पैनक्रियास. पैनक्रियास सिक्रीट क्या करता है, दो सेल्स या दो एंजाइम वो सिक्रीट करते हैं, ये दो हार्मोन सिक्रीट करते हैं. एक है इंसुलिन, दूसरा है ग्लूकागॉन. इंसुलिन और ग्लूकागॉन का जो तालमेल है, द बैलेंस, द कोऑर्डिनेशन बिटवीन ग्लूकागॉन एंड इंसुलिन इज कंटिन्यूअसली वर्किंग 24 आवर्स टू मेंटेन अ बैलेंस ऑफ sugar level to produce energy for us to do our daily activities or daily work that requires energy. Okay, even you are lying down, when you are sleeping or sitting, you are consuming or you are expendituring minimum amount of energy. Vigorous the activity, more the energy demand. Then when the balance between the glucagon and the insulin gets hampered, उसको फिर hamper होने से hyperglycemia होता है, यानी कि high blood sugar level, जिसको हम लोग डायबिटीज बोलते हैं, जो कि एक परिणाम है पैनक्रियास में प्रॉब्लम होने से. प्रॉब्लम क्या है, इंसुलिन रेसिस्टेंस. ठीक है, इंसुलिन रेसिस्टेंस यानी कि इंसुलिन बनने का जो क्षमता है वो रेसिस्ट करता है बॉडी. अगर बनता भी है तो वो एब्जॉर्ब नहीं होता। तो हमारे बॉडी में इंसुलिन सेंसिटिविटी अच्छी होनी चाहिए। अब हमारे बॉडी में इम्पेयर्ड इंसुलिन सेंसिटिविटी या इंसुलिन रेसिस्टेंस क्यों पैदा होता है वो बात का विषय है, पर हमें पहले ये समझ लेना है डायबिटीज कितना डेंजरस एक रोग है, हाउ सीवियर, हाउ डेडली इट इज, एंड हाउ globally prevalent it is. If we talk about global population, every one human out of 11 people is having diabetes. Every one out of 11 people. And among all the diabetic people, only 50% have symptoms. And 50% they don't even know that they are either diabetic or of getting of the entire Indian population is diabetic. If we consider the population of India 1.8 billion,
So your voice is breaking.
uh, is it okay now?
No, sir. Still, it's buffering.
Wait. Is it okay now?
Yes, sir. Now it's okay.
Yeah. If we estimate the entire Indian population to be 1.3 billion, approximately more than 15 to 20 crore of Indians are having diabetes, जिसमें से लगभग 7.5 से 10 करोड़ लोगों को पता ही नहीं है कि उनको डायबिटीज है, क्योंकि डायबिटीज के सिम्टम्स तभी आते हैं व्हेन द ब्लड शुगर लेवल इज मोर देन 250 मिलीग्राम पर डेसीलीटर। ठीक है, अब डायबिटीज के सिम्टम्स क्या हैं जिससे समझ में आ जाएगा कि आपको डायबिटीज है, वो हम थोड़े बाद में जानेंगे, बट उससे पहले ये समझ ले कि प्रेवलेंस कितना है हमने समझ लिया, डायबिटीज होता क्यों अब हमें वो समझना है। वन ऑफ द मोस्ट इंपॉर्टेंट फैक्टर, डायबिटीज क्या है उससे ज्यादा पहले तो ये जान ले हर पब्लिक, जिसको डायबिटीज है वो भी और जिसको डायबिटीज नहीं है वो भी, कि डायबिटीज होता क्यों है। डायबिटीज का जेनेटिक्स से बहुत गहरा ताल्लुक है, बहुत गहरा संबंध है। इफ एनी वन ऑफ द पेरेंट, either mother or father, is having diabetes, so the chance of the child to get diabetes is more than 50%. ठीक है, तो genetic predisposition is huge. Second, if we are having sedentary lifestyle, the chances of you getting diabetes is more than 30%. Second cause. Third cause, if we are obese or overweight, the chances of getting diabetes is really high, relatively higher. ठीक है, if you are a smoker, the chances of getting diabetes is higher. ठीक है, these are all the major, very easy, quickly to recognize causes that if you are having it in our life, then we can be, cautious enough from the very beginning. So इसके वजह से the early you understand, the earlier you recognize, and the earlier you recognize, earlier you take some step or necessary actions to deal with any kind of problem. ठीक है, तो ये सब मोटा मोटी चीजें हैं। तो डायबिटीज का जो टाइप्स है अगर हम वो समझ लें तो ये भी जानना बहुत जरूरी है। वी नीड टू अंडरस्टैंड द टाइप्स ऑफ डायबिटीज। इफ यू फाइंड अ चाइल्ड हैविंग डायबिटीज, like suppose he or she is the age of 7 or 8 or 10, 12, 14, 15, so that's the diabetes that is called type 1 diabetes. ठीक है, that is insulin dependent diabetes where the insulin medication is 100% necessary. You can't avoid insulin injection or insulin therapy. ये होता है बच्चों को, कम उम्र में ये होता है, and that is an autoimmune disease. It has very less to do with your lifestyle. It has very less to do with your obesity, smoking or any other kind of thing. It is autoimmune disease. क्यों होता है किसी को नहीं पता, कम उम्र के बच्चों को होता है। टाइप 2 डायबिटीज, नॉन इंसुलिन डिपेंडेंट डायबिटीज बोलते हैं, ये होता है बड़ों को। व्हेन यू क्रॉस द एज ऑफ 25, 30, 40, देन ड्यू टू बैड और अनहेल्दी लाइफस्टाइल you have type 2 diabetes where taking insulin is not necessary. It only gets necessary when your diabetes is not controlled or very poorly controlled, and where your clinical manifestations are so bad or so worse where it is not getting controlled with diet, exercise and tablets or drugs, that is medication. ठीक है, there is another kind of diabetes that is happening during pregnancy, that is called as gestational diabetes. ठीक है, गर्भवती महिलाओं को होती है। उसमें भी काफी चीजें हमें समझने की बात है. अगर वो होगा, so what can be the deadly manifestations or complications that might hamper the child and the mother? So that things need to be discussed with your gynecologist so that you can deal with it early. Because agar gestational diabetes is not controlled, so the baby might land up with macrosomia or any other kind of endocrine problems like thyroid, or the baby can have a high blood pressure predisposition, or the baby can have a diabetes predisposition if the mother is not controlling her diabetes from the very beginning. Kab 24 hafta, after 24 weeks, the mother should get her diabetes checked and take it very seriously if the diabetes level is even more than 140 fasting glucose. Fasting glucose, if it is more than 140 milligram per deciliter, the mother should be very, very serious about it to prevent any mishap for her child and for herself. ठीक है बिलाल, अभी तक मामला क्लियर है? एंड माय वॉइस इज ऑडिबल? ठीक है. तो डायबिटीज हमने, व्हाट डिड वी अंडरस्टैंड? टाइप्स ऑफ डायबिटीज. टाइप 1 डायबिटीज, दैट इज ऑटो इम्यून इन नेचर and it hampers or affects the young population from 5 to 14, 15 years of old. Type 2 is adult diabetes, that happens to adults specifically after the age of 35 to 40. The third category is gestational diabetes, that happens to pregnant ladies after the age of after 24 weeks. Fourth number is MODY, maturity onset diabetes for young people or for young population. Even that happens after the age of 14 to 15. Okay. Fifth number category is neonatal diabetes. The mother was not diabetic, but when the kid is born, during day 1 to 1 year, if the child is predisposed to diabetes, that's called as neonatal diabetes. There are other kind of diabetes that is happening not because of lifestyle or genetics or autoimmune problem. It can also be because of certain drugs. So when you are having such kind of people that are having phenytoin type of drugs, phenytoin, people who are having long-term steroid intake, people who are having long-term sulfonylurea kind of intake, so those drugs can induce hyperglycemia or diabetes or high blood sugar. ठीक है. So basically we dealt with 5 or 6 types of diabetes. The most common and the most prevalent diabetes is type 2 diabetes, which affects 90% of the population, and 10% of the remaining population, diabetic population, is type 1 diabetes. So basically what we will be focusing on type 2 diabetes. ठीक है. Now people might be thinking, let's quickly understand the signs and symptoms of diabetes. कैसे हम समझेंगे कि आपको डायबिटीज है? I always repeat, you should always remember, among the diabetic population, only 50% they have symptoms, and the rest of them they don't have symptoms unless the blood sugar is crossing 250 milligram per dl. 250 से ऊपर जाएगा तो ही आपको symptoms आएंगे. क्या symptoms आएंगे? Remember the 3 P's: polyuria, polydipsia, polyphagia. What is polyuria? Excessive urination. Polydipsia, excessive thirst. Polyphagia, excessive hunger. ठीक है. 4 number is weight loss, rapid unexplained weight loss or fat loss. 4 cardinal symptoms of diabetes is polyuria, excessive urine, polydipsia, excessive thirst, polyphagia, excessive hunger, and fat loss. ठीक है. These are the symptoms. Bilal, do you want me to cover?
Yes, sir.
Wait. तो सिम्टम्स से कोई प्रॉब्लम अभी तक? ठीक है अभी तक?
No, sir.
डायबिटीज से पहले, before diabetes is full-fledged hitting you, there is something called as pre-diabetes. Like you have not entered the fraternity of diabetic people, but still you are on the verge of entering diabetes. So that we should be understanding. What should be the glucose level during blood test that tells you that you are on the verge of pre-diabetes? Fasting blood sugar level of more than 126 is known as pre-diabetes. Okay, sorry, fasting blood glucose level, if it is from 100 to 126, it's pre-diabetes. And if it's crossing 126 fasting blood sugar level, where 8 hours of complete fasting is mandatory, then that's known as diabetes. Postprandial glucose test, that is 2 hours after 2 hours of meal, when the blood test taken, when it is more than 148 mg per dl, then that's called a diabetic. Okay, another blood test is commonly done, that is known as HbA1c, that measures the amount of glycated hemoglobin. It is usually done in chronic diabetic people. Randomly, you should not check HbA1c mainly. Usually fasting blood sugar is enough, and PP, that is 2 hours after taking your meal, blood test is enough. HbA1c is done in chronic diabetic people. So what is the ratio? When you are having more than 6.5% of HbA1c, then you are having diabetes, or it is not good controlled. And if it is 6 to 6.5, then your diabetes is good controlled, but still you are into pre-diabetic region or pre-diabetic domain. When the HbA1c is more than 7.5, then it is poorly controlled. When it is more than 8.5 to more than 10, then it is on the verge of giving you several complications like problem in the retina, that is diabetic retinopathy, problem in the kidney, diabetic nephropathy, and problem in the peripheral nerves, diabetic neuropathy. Okay? When your diabetes is not controlled with diet and lifestyle, American Diabetes Association has clearly laid down the formula or the strategy or the guidelines. When you are not obese, when you are not having cardiac issues, or when you are not having high cholesterol or any kind of cardiac issues, first 6 months, you should manage your diabetes with diet and lifestyle. And if you're having obesity or overweight and you have predisposed cardiovascular issues, then you should start with low dosage of the drugs that your doctor will prescribe you. But make sure lifestyle medicine or lifestyle modification should be remaining throughout. It should not be neglected or taken casually. Your doctor can stop you or can make you go away from diabetic drugs, but your doctor will never tell you to go away from lifestyle medicine, because that is a true sustainable, practical, and most reasonable solution for your diabetes, because diabetes is mostly a lifestyle problem or a lifestyle induced disease. So that has its root through treatment engraved and ingrained in lifestyle medicine or lifestyle modification. ठीक है?
Yes, sir.
So firstly, what I told, diabetes है तो समझेंगे कैसे? Symptoms मैंने बता दिया. I talked about symptoms. Then the test that is required for
Yes, sir.
understanding diabetes is usually fasting blood glucose, that is more than 126, and PP, that is 2 hours after having a carbohydrate rich food, more than 148. Okay. Symptoms when they try to
Yes, sir.
erupt, symptoms come only when the blood sugar level is more than 250. So don't wait for the symptoms to come. If you have sedentary lifestyle, if you have a family history of diabetes, if you are more than 45 years of age, and if you smoke, and if you have dyslipidemia, if you have low folic acid level, you have high cholesterol, if you have higher triglycerides, make sure you get your blood sugar level checked every year. Let me tell you something very interesting. there is something called metabolic syndrome. Okay, people who have metabolic syndrome, they have highest chances of having diabetes. You can quickly understand whether you are a sufferer of metabolic syndrome or you can have metabolic syndrome. There are five signs of metabolic syndrome. Out of 5 signs, if 3 are met, you are having metabolic syndrome. What are they? Number 1, abdominal circumference for men more than 40 inches and more than 35 inches is women. Number 1. Number 2, high triglyceride level more than 150. Number 3 is age more than 40. Number 4, high triglyceride, high abdominal circumference. Yes. Number 4 is high blood pressure more than 135 systolic and more than 85 diastolic. Okay. कितना बोला मैंने बिलाल? Metabolic syndrome. First one is abdominal circumference. Abdominal circumference. If it is more than 40 inches in men and more than 35 inches is women. Number 1. Yes. Number 2, high triglyceride. More than 150. Triglyceride level. More than 150. Number 3, systolic pressure more than 135, diastolic more than 85. Okay. Fourth one is low HDL. Low HDL. What is HDL? HDL is high density lipoprotein. HDL is also known as good cholesterol. If HDL is more than 40 in males, if it is less than 40 in males and it is less than 50 in females, then it is qualifying the criteria of metabolic syndrome. There are more than 25% of people who are silent sufferer of metabolic syndrome. And let me quickly remind you all that metabolic syndrome might not just lead to diabetes, it might also lead to severe cardiovascular events like ischemic heart disease, hypothyroidism, end stage renal disease. Renal disease will appear, but you might be unaware. Okay. You suddenly don't have tachypnea, you suddenly don't have dyspnea, you suddenly don't have orthopnea, you suddenly don't have ankle edema or pedal edema. These all come step by step. And when you don't know the strategy, when you are not truly understanding the paradigm and the methodology of understanding, accepting, and taking action, then you might land up with huge fatality. Because the mortality rate due to diabetes is huge. It's 6th or 7th in rank. It's 6th or 7th in rank in all-cause mortality in the global world. Okay, and surprisingly, India ranks 2nd in the world's most diabetic populated nation. Number 1 is China. Number 2 is India. Number 3 is United States. Okay, so we should all remember metabolic syndrome. If 3 out of 5 criteria are met, then you are having metabolic syndrome. Please go to your physician and please be in charge of your own health by improving your lifestyle, improving your diet, improving your...
So what was the fifth one you told?
Age more than 40.
Fifth one.
Age more than 40.
Age, okay. Okay.
Abdominal circumference, high triglyceride, lower HDL, high blood pressure, age more than 40.
Sure, sir.
Yeah.
I sat with a pen and copy, so I can note accordingly.
You always take notes, no matter whoever the lecturer is. I have always realized this. You take notes. This is a sign of good student, good learner.
And Dr. Kiran is asking, can you repeat pre-diabetes?
Yeah, pre-diabetes. And if you talk about gender specific, females are more hit than males. Pre-diabetes वो होता है जो अभी आप डायबिटीज में गए नहीं हो, you are on the dahliz, you are on the doorstep, you have not fully entered the area of diabetes, where your pancreas is not totally compromised or hampered. It is still making insulin and your insulin level is still absorbing the glucose circulating in the blood, but due to some pro-inflammatory cytokines, due to some pro-inflammatory mediators, due to some hampered cortisol level in the female. Why am I talking about female? Because female are more inclined towards diabetic due to low or hampered cortisol level, due to hampered progesterone level, due to hampered estrogen level, due to high prolactin level. Always remember, if you have prolactinemia, high prolactin level, make sure you talk to your doctor, and make sure you check your blood glucose level every 6th month. These pro-inflammatory mediators are one of the biggest culprit behind diabetes. Sedentary lifestyle induces pro-inflammatory cytokines. High fat, high saturated fat, high trans fat foods induces the pro-inflammatory cytokines. But many people, they are not into bad diet. They are having healthy diet. They are truly having and enjoying ghar ka khana. They are not smoking. They are not alcoholic. They are exercising daily. But yet, the pro-inflammatory cytokines, the inflammations level are higher. It can be because of multiple reasons. It can be because of poor sleep habit. It can be because of unexplained stress level. It can be because of depression. So it's not just one hit target area that you need to focus on. It's a multiple hit target for diabetes. So pre-diabetes kya hai? In short, I say you are not diabetic, but you are into entering the diabetic domain. That is, your fasting blood sugar level, when it is from 100 to 126 and below, then it is pre-diabetic. And your HbA1c level, if it is 6 to less than 6.5, then that is pre-diabetic. Okay, so this is pre-diabetic. So if you are pre-diabetic, then exercise and lifestyle changes is the best solution for reversing your pre-diabetes to being normal. Okay, so let's not just do solutions. First, understand what will happen if you don't tackle diabetes. The complications, in short, it might hamper your heart, it might hamper your eyes. People go blind in lakhs. Every year, 20 to 40,000 people, they go blind due to diabetic retinopathy. If you have long-term diabetes, please go and check your eyes under a good ophthalmologist once in every year, to avoid diabetic retinopathy, to avoid macular edema or macular degeneration. First complication. Second complication is diabetic nephropathy. How will you understand you are having diabetic nephropathy? You will be having excessive urination. You will be having ketone bodies in your urine level. So urine analysis is also important once in a year. If you have high number of ketones, that means you are in the verge of having diabetic nephropathy, that is kidney affection. When your estimated glomerular filtration rate, eGFR, it's less than 30, it's not time to sit at home and wait for the problem to solve by its own. It's time for you to visit your nephrologist or a diabetic specialist. When the microalbumin level is more than 50 to 300, then it's time for you to take strict action. So all these levels should be checked in long-standing diabetic people. Microalbumin area more than 300, it's time for you to consider that you might be having chronic kidney disease or stage renal disease, where you will be having pedal edema, ankle edema at night, and many other problems, polyuria, foul smell, and sweet urine and all. These are all the signs of end-stage renal disease, where people end up with dialysis, and some may need kidney transplant. Third complication of uncontrolled diabetes is peripheral neuropathy, diabetic neuropathy. So get your feet checked once in every year. Get your feet checked so that you don't land up with amputation when picking the foot. Diabetic neuropathy में क्या होगा? First, the sensory loss is witnessed. Sensory loss. Okay. So these things might be important to understand. The complications. Ketoacidosis is also one of the very important thing that people suffer, but they don't understand. Ketoacidosis में क्या होता है? The ketone bodies go higher in urine level or in urine. कीटोएसिडोसिस में क्या होगा? You are too lethargic, you are too weak to do your daily activities, you are too hungry, you are too thirsty. Okay, you will be having ketone odor from your mouth, that is bad breath, very foul breath from your mouth. You will be having trembling and tremor in your hand. Your hands will shake, your legs will shake. You will be having dyspnea while you walk or while you do moderate to vigorous intense activity. So these are all the complications of ketoacidosis. Okay, so we all must realize what problem we are having so that you reach your doctor timely. So complications short में ये सब चीज हमें जानना जरूरी है, हमें ये समझना बहुत जरूरी है. कॉम्प्लिकेशंस भी हो गया, टाइप्स ऑफ डायबिटीज भी हो गया, मेटाबॉलिक सिंड्रोम भी हो गया. शॉर्ट में आप क्या बताए? एक्सरसाइज एंड न्यूट्रिशन. ठीक है. Make sure you
Yes, sir.
discuss with your doctor about drugs. Nobody on earth is against drugs, whatever drug therapy you choose, but make sure you talk to your doctor, a doctor who is thoroughly knowledgeable on lifestyle medicine, nutrition, exercise, and her own expertise, be it allopathy or whatsoever pathy you choose. Okay. But American Diabetes Association has recommended that first 6 months only exercise and lifestyle should be, and exercise should be tried. If you are not having more than 200 mg per dl of pp blood sugar. If it is less than 200, you are not obese, you are not having already cardiovascular events, then for first 6 months only exercise and diet should be tried. Drugs should be kept second option. Okay, but when needed, don't abstain and don't run away from drugs considering कि मुझे जिंदगी भर दवा खाना है. खाना पड़ेगा, खाना खाते हो जिंदा रहने के लिए, दवा भी खाना पड़ेगा जिंदा रहने के लिए. बट उसके साथ लाइफस्टाइल एंड एक्सरसाइज से छुटकारा नहीं पा सकते. You should be considering lifestyle medicine as your primary care, as your primary mode of treatment. ठीक है. Diabetic nephropathy. Please, diabetic nephropathy is a problem in the kidney that ends up with high microalbumin ratio in the urine, that ends up with lower glomerular filtration rate, less than 30. If it is less than 60 also, then it's a problem with diabetic nephropathy. Okay. When there is presence of ketone body in the urine, so that is indicating diabetic nephropathy. It's time for you to talk to your doctorologist or your nephrologist. So in short, this is diabetic nephropathy. When we are not dealing with diabetes and when it is not controlled, तो nephropathy हो सकता है. ठीक है. उसके और भी symptoms हैं like anasarca. Anasarca is generalized body swelling. तो ये सब चीज से भी समझ में आता है कि इस बंदे को या इस बंदी को नेफ्रोपैथी हो चुका है. ठीक है. तो बिलाल complications के बाद अब हमें I was talking about treatment. ड्रग थेरेपी से हमें
एक्सरसाइज एंड न्यूट्रिशन.
हाँ नहीं, पर ड्रग थेरेपी से हमें भागना नहीं है. People nowadays come up and speak against allopathy medications. Okay, that you should not take allopathy medicine. अगर लेंगे तो जिंदगी भर लेना पड़ेगा. डायबिटिक मेडिकेशन जितना जरूरत है उतना, बट उससे ज्यादा फोकस करना है हमें ऑन लाइफस्टाइल. इफ यू आर कंट्रोलिंग दिस, what are the factors that you should deal with lifestyle? A good happy peace of mind, a good happy sleep, a controlled tongue, a controlled heart, a good pumped muscle where you are physically active and you are doing exercise, and a good social life. Okay, ये सब चीज है जो हमें कंट्रोल करना है. These all comes under lifestyle. Now न्यूट्रिशन में हमें क्या और कैसे डील करना है ये हमें समझना है. आई विल टेक मोर 5 minutes टू क्विकली रैप इट अप. न्यूट्रिशन में देयर इज नो वन साइज फिट्स फॉर ऑल. Somebody will say low carb diet is good, somebody will say Atkins diet is good, somebody will say Mediterranean diet is good, somebody will say Desi Indian diet is good, somebody will come up with ketogenic diet is good, somebody will come up with Dr. Bishwarup Roy Chaudhary is not even a doctor. Bishwarup Roy Chaudhary's diet known as the China diet. और क्या है एक बहुत फेमस है. I should make people aware of these kind of thing. क्या बोलते हैं उसको, I don't remember Vishwarupa Chaudhary's diet. So they are coming up with multiple diets. I'm not blaming any one diet. Let's say all diets are good, but the thing is, the diet that is suitable for you, the diet that is favoring you, the diet that is practically possible for you, the diet that is economically sustainable for you, that is the best diet for you. But make sure you are avoiding certain things. What are the things that you need to avoid? High carb foods, high fatty foods, high trans fat and high saturated fats that you need to avoid. Okay, foods that are high in glycemic index, foods that is high in glycemic load. ये यहाँ पे एक फंडा है, यहाँ पे हम समझना होगा ग्लाइसेमिक इंडेक्स क्या है और ग्लाइसेमिक लोड क्या है. कुछ भी खाना हम खाते हैं वो ग्लूकोज में चेंज होता है, यानी शुगर में चेंज होता है और हमें एनर्जी प्रदान करता है. जो खाना खाने का 2 से 3 घंटा बाद ग्लाइसेमिक शुगर बढ़ता जाए और बढ़ता रहे, यानी कि उस फूड का ग्लाइसेमिक इंडेक्स हाई है. जो खाना खाने के बाद इक्विवेलेंट टू 50 ग्राम ऑफ व्हाइट ब्रेड, इक्विवेलेंट टू 50 ग्राम ऑफ हाई व्हाइट ब्रेड, अगर जो खाना खाने का 2 से 3 घंटा बाद शुगर लेवल आहिस्ता आहिस्ता बढ़ता है, एक बार में अब्रप्टली देयर इज नॉट अ स्पाइक इन शुगर लेवल, देन दैट फूड इज हैविंग मॉडरेट टू लो ग्लाइसेमिक इंडेक्स. ठीक है. एंड व्हाट इज ग्लाइसेमिक लोड? ग्लाइसेमिक लोड वो है कि जो हमारे पैनक्रियास में कितना लोड प्रोड्यूस कर रहा है फॉर द इंसुलिन टू कन्वर्ट द शुगर लेवल. और ठीक है, एनी फूड that is having high glycemic index more than 50 is a food that is having moderately high glycemic index. ठीक है, जैसे रोटी, दाल, चावल, ये सब चीज का ग्लाइसेमिक इंडेक्स मोर देन 80 है, बनाना मोर देन 60 है, एप्पल मोर देन 50-60 है, आइसक्रीम मोर देन 100 है, पास्ता मोर देन 80 है, नूडल्स मोर देन 80-90 है. ठीक है, रोटी मोर देन 80-90, 100 भी है अगर उसमें ज्यादा फ्लोर है, ज्यादा तेल है. ठीक है, कौन कौन सा खाना जिसका 50 से कम है ग्लाइसेमिक इंडेक्स? चेरी, बेरी, गुआवा, वेजिटेबल्स, मीट, फिश, एग्स, these are all foods that is having glycemic index less than 50. तो हमेशा याद रखना, खाना जो भी खाएं कंप्लीट मील खाएं. जब कंप्लीट मील होता है which has a ratio and balanced ratio of low to moderate carb, moderate to high protein, low to moderate fat, अगर ये सारा रेशियो बैलेंस्ड है देन यू आर हैविंग अ बैलेंस्ड मील. कभी भी आपका नहीं बढ़ेगा शुगर लेवल. अगर आप चावल भी खा रहे हो, आलू भी खा रहे हो, बट उसके साथ आपका प्रोटीन भी है, खाने का टाइमिंग भी सही है, आप ठीक से खाना चिबा रहे हो, यू आर च्यूइंग योर फूड वेल एंड यू आर कंबाइनिंग अ कंप्लीट सोर्स ऑफ प्रोटीन, फैट and carbohydrates in a complete meal, you are not having an isolated meal, then the chances of you having a sudden spike or surge in the blood sugar level is very less. ठीक है. So what there are certain times that we need to consider that we cannot discuss in detail in one live session. तो खाने में मैंने क्या बोला, ये सारा चीज हमें ध्यान रखना है. Foods that are high in protein is absolutely necessary. Majority of the diabetic people are not getting sufficient protein intake. Make sure you are getting 1 gram per body kg of protein daily in your diet. If you are 70 kg, make sure you are getting 70 gram of healthy protein daily in divided doses. ठीक है. Make sure you are getting all anti-inflammatory foods. As I earlier told, diabetes is because of pro-inflammatory mediators in the body. So to reduce the inflammation level, you need to have anti-inflammatories. You can add chia seeds, you can add flax seeds, you can add berries, you can add strawberries, you can add kiwi, you can add jamun, you can add guava, you can add all fruits. These are high sources of antioxidants. You can add curcumin, haldi, you can add cinnamon. You can't believe, if you daily take 5 gram of cinnamon powder mixed in a water, your blood sugar will go down slowly, beautifully. So far so much that you might end up with hypoglycemia, low blood sugar. अब आप समझ लो लो ब्लड शुगर बोलते किसको है. Hypoglycemia is a blood sugar level less than 70. If your blood sugar level is less than 70, you are hypoglycemic. Stop. Talk to your doctor, modify, adjust your diabetic medications. If you are taking insulin, adjust your insulin dosage by talking to your doctor. If you are exercising, control your exercise intensity, bouts, time, duration, frequency, repetitions. Reduce your protein intake and little bit increase carbohydrate intakes. So these things is very complication. Managing diabetes is not easy. So that is why managing diabetes is not a one-man show, not a one-man army show, or not a one-man headache. Your doctor is just doing 10 to 15 to 20% of the entire management. The remaining comes from you, within you, by you, on you, in you. The remaining comes by your dietitian, then comes from your family member, your society that you live in, your exercise specialist, your yoga trainer. Okay? So always talk to understand your problem. Majority of the people, they are having or facing the wrath, ghazab जो लोग फेस कर रहे हैं डायबिटीज के, वो इसीलिए करते हैं. They don't know, they don't realize, they don't talk, and when they don't talk, they don't learn, they don't bother, they don't care, and they don't get the proper optimum result. There are beautiful herbs, HERBS, okay, herbal recipes that reduces the pancreatic load, that increases the insulin sensitivity and decreases the insulin resistance at the same time, decreases your blood sugar level. But you have to accept majority of the herbs and spices in the Indian kitchen are drugs. They are beautiful anti-diabetic drugs. But we Indians, having a good medicine cabinet in our kitchen, we ourselves are away from the proper sources of anti-diabetic medications like cinnamon, garlic, chia seeds, makhana. You know makhana? Those are the rose seeds. Makhana. North Indians, those people, they enjoy makhana in their snacks. Makhana is a very beautiful source of low carbohydrate, high protein, high zinc, high antioxidant. जब बॉडी में ये सब चीज जाएगा, it takes time. Time and tides wait for none. You have to be patient. आप सिर्फ दवा के ऊपर भरोसा रहोगे, जिंदगी बर्बाद होने वाला है, गर्क होने वाला है. Dava will only play a role of 40%, 30 to 40%. Remaining 60% has a divided role of lifestyle and exercise, diet and exercise. But make sure you must be understanding, if you are a diabetic person, what time you should do your exercise, how much you should do exercise. American Council of Sports Medicine has clearly formulated a guideline. And please make sure that you don't get confused between guidelines and prescription. गाइडलाइन एक खुलेआम रास्ता है जो आपको गाइड करेगा कि कहाँ जाना है, कब जाना है, कैसे जाना है, कितना तक जाके फिर रुक जाना है. दैट इज नोन एज प्रेस्क्रिप्शन, एंड प्रेस्क्रिप्शन इज ऑलवेज डन बाय अ स्पेशलिस्ट. ओके, ड्रग थेरेपी ड्रग स्पेशलिस्ट देंगे, एलोपैथ फिजिशियंस या आयुर्वेद फिजिशियंस. ठीक है, डाइट थेरेपी डाइट स्पेशलिस्ट देंगे, आपको डॉक्टर नहीं देगा अनलेस द डॉक्टर इज ट्रेन्ड इन डाइट. वो देगा डाइटिशियन या न्यूट्रिशनिस्ट. एक्सरसाइज आपको डॉक्टर नहीं बोलेगा, ही इज नॉट ट्रेन्ड इन डूइंग सो अनलेस ही इज ट्रेन्ड. वो कौन देगा? आपका एक्सरसाइज स्पेशलिस्ट. कौन होते हैं वो लोग? फिजियोथेरेपिस्ट, एक्सरसाइज फिजियोलॉजिस्ट, ओके, एक्सरसाइज काइनेसियोलॉजिस्ट, people who are trained and specialized in exercise. If your doctor is specialized in doing so, he is most welcome to prescribe you. How do we prescribe exercise in diabetic? The formula of FIT and the formula of SMART should be remembered. What is the formula of SMART? S for specific, M for measurable, A for adaptability, R for reasonable, T for time. The formula or the principle of SMART is always we prescribe in any disease we are dealing with. I being a exercise specialist, doctor of movement, doctor of exercise, doctor of physiotherapy, what I will be dealing, I will be controlling your diabetes through exercise by laying down your body, your persona, your entity, your existence by two principles. Principle of SMART, specific, measurable, adaptive, reasonable, time. Then comes FIT, F for frequency, I for intensity, T for time, and T for
Type.
the type of exercise that you are doing. ठीक है? The exercise should be specific. No one size fits for all. अरे वो तो करता है चलो मैं भी वो कर लूं. No, it should be specific for you. M for measurable. You can measure the amount, the dose, the quality of exercise. A for adaptable. You should be adaptable to that environment giving you that exercise. ऐसा नहीं कि randomly it is everybody that can do any kind of exercise. R for reasonable. It should be reasonable enough that whether you are eligible to do that exercise or continue that exercise. And T for time. So the proper timing is very necessary. For example, if you are a diabetic patient and your diabetes is controlled, knowingly, unknowingly, your diabetes is getting lower and lower. It's getting lower than 100 and it gets lower than 80, 70, then that's hypoglycemia. Stop. Do not do exercise. That is why if you are into diabetic medication, if you are into insulin, American sports medicine has clearly laid down the foundation principle that take 15 grams of carbohydrates, then do your exercises to prevent hypoglycemic episode. How will you understand you are having hypoglycemia? You will be having certain sets of symptoms that you should quickly recognize. But unfortunately, only 50% or 60% of people, they have symptoms, and they have hypoglycemic unawareness. This phenomenon is called hypoglycemic unawareness, where you won't be having the symptoms. What are the symptoms? It is excessive sweating, headache, anxiety, nervousness, shakiness of the hands and leg, and tingling sensation in the mouth or the fingers. These are the true symptoms of adrenergic symptoms, because there is a sudden decrease in the blood sugar level due to exercise. You are becoming hypoglycemic. Stop your hypoglycemic spike and stop your exercise. What should you do to come out of hypoglycemic state? Because if you are not controlling your hypoglycemia, you might end up with coma, you might end up with seizure, you might end up with loss of consciousness. Okay, you might faint. So what you should do to avoid hypoglycemia? You should remember 15 formula. The formula of 15. Take 15 grams of carbohydrate or sugar. If it is not increasing your blood sugar level more than 70, more than 100, then again repeat the formula of 15. What is formula of 15? 15 grams of sugar. It can be half a glass of fruit juice. It can be 3 teaspoons of sugar, table sugar. It can be 3 to 4 tablets of sugar or sugar candies, 3 to 4. Don't take 7, 8 tablet sugars. Don't take 6, 7 teaspoons of table sugar. It will then again give a glycemic surge or glycemic hike. Okay, always remember the formula of 15. If formula 15 is not working, immediately the sugar level is not going above 70, then repeat the treatment or go to the formula of 20. Take 20 grams of sugar. That is little bit more than half a glass of fruit juice, or 4 to 5 tablets of sugar. So that is why glycemic patients or diabetic patients should always carry sugar candies or tablets with them in their bag, in their pockets, to avoid states of hypoglycemia. It's a very pathetic thing. It is more dangerous than hyperglycemia, because hyperglycemia hone ke baad problem, they don't happen suddenly, but hypoglycemia can cause death within couple of minutes if you don't control it. Okay, as I told you, the symptoms, those are adrenergic, and there are symptoms that are neuroglycopenic. What are the neuroglycopenic symptoms? Those are certain severe things: severe headache, drowsiness, mental confusion, okay, sudden paroxysmal loss of memory, amnesia that we call, and seizure, coma, loss of consciousness. These are known as neuroglycopenic symptoms. If you're having these kind of things, never ever think that you should continue exercise. You should immediately talk to your doctor and take emergency actions. That is why whenever a diabetic patient is doing exercise, always do exercise in group, sorry. Do it with your partner, do it in a group, so that अगर कोई hypoglycemic event आता है, so necessary actions can be taken. ठीक है, तो डाइट लेके क्या समझ में आया?
So, yes, डाइट तो बेसिकली वही कि कितना कार्ब खाना चाहिए और एक बैलेंस डाइट होना चाहिए.
Balanced diet, yeah. Low to moderate carb, moderate to high protein, low to moderate fat.
प्रोटीन
ज्यादा नहीं, 40% of carbohydrates होना चाहिए. 40% of your total calorie intake should be from carbohydrate. 20 to 30% should be from your protein, or 30 to 40% from protein, and only 10 to 20% of your total calorie intake should be from fat. Fat कौन सा? Healthy fats, MUFA and PUFA. MUFA मतलब mono unsaturated fatty acids, PUFA मतलब poly unsaturated fatty acids. The healthy fats, meat, chicken, turkey, beef, mutton, but in a very limited quantity if you're not having cholesterol, dyslipidemia, and you're not a smoker. Eggs, shrimps, fish, these are all beautiful sources of protein. So far, one of the most reasonable diet that is being considered for diabetes is Mediterranean diet, because it is economically possible and it is very flexible, and it's not a rigid diet like Atkins diet, ketogenic diet. It is not very rigid. Mediterranean diet is very, very beautiful diet to control your diabetes. Now always remember the 5 gram of cinnamon powder. 5 gram of cinnamon powder can do wonderful treatment for your diabetes, but make sure you're not going to hypoglycemia. And if you are taking diabetic medications, if you're taking insulin, do not start cinnamon powder water. Do not take cinnamon powder. You might land up or end up with hypoglycemia, low blood sugar. High blood sugar झेल लो बाबा, low blood sugar मत झेलना. Low blood sugar can be fatal, deadly. So before taking any herbs, I should give a disclaimer over here. Before taking any herbs, any spices, any desi drugs, please talk to your doctor and make a very reasonable, logical, sound consent decision, and a very informed decision. Do not take random decisions. Formula of 15, Dr. Kiran, ये है, when your blood sugar level is going less than 70, you should apply the formula of 15. Formula of 15, take 15 gram of sugar or 15 gram of carbohydrates. ठीक है, वो 15 ग्राम ऑफ शुगर कैसे मिलेगा आपको? 3 टीस्पून ऑफ शुगर और हाफ अ ग्लास ऑफ फ्रूट जूस, ठीक है, या 2 to 3 मिठाई या स्वीट. Formula of 15 does not work. Repeat formula of 15. Your blood sugar level should immediately go above 70 mg per dl. If it is not going, apply formula of 20. If it is still not going, then the emergency drugs are given epinephrine, but these are given in supervision of a doctor. So formula of 15 we should always remember. Hyperglycemia symptoms only occur when the blood sugar level is approximately more than 250. You might find people who are having 300 blood sugar level, they are doing so good, they are doing so well, they don't have any symptoms. That is why I always say, to avoid hypoglycemia, to avoid low blood sugar, do not take exercise immediately after insulin therapy. Wait for 2 to 3 hours. Because कौन सा insulin चल रहा है, we should always, whether it is rapid acting analogs insulin or a very long acting insulin. Rapid acting insulin में, if you do exercises immediately after taking your rapid acting or analog insulin, you might land up with hypoglycemia. So after insulin therapy or taking insulin, wait for 2 to 3 hours, then go for exercise. And always do exercise, begin with aerobic exercise. Aerobic exercise will tackle the hypoglycemia. It will not induce hypoglycemia. So if you ask me what exercise is best for me, there is no one specific exercise that is best for you. Always combine a bit of aerobic exercise, and always combine aerobic exercise with resistance exercise. Aerobic and resistance exercise is the one of the best solution. No one type fits for all, or one size fits for all. American Council of Sports Medicine has given the formula of 150 minutes or 75 minutes. If you are doing moderate intensity exercise, 150 minutes of exercise in a week. If you are doing vigorous intensity exercise, then 75 minutes of exercise in a week. There are other parameters. How much should be your VO2 max for your moderate intensity and high intensity exercise? How much should be your resistance exercise parameters? These are all should be discussed or being taken under a guidance of a qualified physiotherapist or a qualified exercise physiologist. Randomly, don't start doing exercises by going to a gym. You might land up with severe trouble. If your personal trainer or a gym trainer is qualified enough to understand the problems, if he or she is eligible to apply CPR, if he or she is able to give you first aid, what is to be given or done in hypoglycemia, then only go to that gym. Otherwise, refrain from going to gym. Rather, talk to your doctor. Go to a qualified physiotherapist who is well trained and well expertise in dealing diabetes with exercise therapy. Because exercise is medicine. It's not just some random solution. राह चलते हुए, रास्ते में चलते हुए, रास्ते घाट में चलता हुआ कोई नसीहती एडवाइस नहीं है. It is a therapy, it is a medicine, it is a drug. It is the most priceless drug available on earth. तो ये राह चलते हुए पूछना नहीं चाहिए. आप आके बैठो क्लिनिक पे, get it prescribed on a prescription. ठीक है? Everybody should remember this.
ओके सर, थैंक यू. आपने कहा था आप शॉर्ट सेशन लोगे, but I think it's around 1 hour.
I always go
But,
beyond limit. This is the half an hour का बात था, it's 1 hour.
बट ये है कि बहुत कुछ न्यूज सीखने को मिला मुझे भी, इसलिए मैं पेन कॉपी लेके बैठ गया तुरंत ताकि नोट डाउन कर सकूं.
जी, बहुत कुछ है. एक्सरसाइज थेरेपी का पूरा अगर चीज हम समझने का कोशिश करें, so it will take days of classes to understand the dosage, to understand cardiovascular events and diseases. अब जैसे metabolic syndrome is a huge effect. I haven't touched the Somogi effect. I haven't touched the Dawn effect. Somogi effect, Dawn effect are the phenomenon that happens hypoglycemia. Dawn effect होता है सुबह को, सोमोगी इफेक्ट होता है शाम को. ये क्या होता है? सो इफ यू डिस्कस, इट विल टेक आवर्स. ठीक है,
ठीक है सर. तो फिर कभी इस पे भी कोई एक स्पेसिफिक सेशन रखेंगे 2-3 दिन का आपके लिए.
बट एक चीज याद रखना, इफ यू डू एक्सरसाइज,
एंड आई थिंक
if you do exercise and if you preserve the muscle mass, if your muscle mass is preserved, डायबिटीज कुछ नहीं बिगाड़ सकता आपका, कुछ नहीं बिगाड़ सकता. डायबिटीज है, रहने दो, जिंदगी भर रहने दो, कोई बात नहीं. आपका न्यूरोपैथी, आपका नेप्रोपैथी, आपका हार्ट हेल्थ, आपका लंग्स हेल्थ, all will be healthier and they will be giving you दुआएं. It will be blessing you all if you preserve your muscle mass. Do not let your muscle break down and convert into fat. Rather preserve your mass and pump your mass. Don't just believe in stretching and all. Apart from stretching, believe in building muscle mass and reducing your abdominal and visceral fat. That is why I told metabolic syndrome का पहला शर्त यही है कि abdominal circumference, पेट को कमाना. Reduce your abdominal or visceral fat. That is criminal. That is huge, a big problem.
yes, definitely.
बिलाल, आप समझा दो.
And I think,
tell us 5 to 6 tips of understanding diabetes. Not understanding, managing diabetes. क्या क्या चीज हैप्पी रहेगा, क्या क्या चीज हैप्पी रहेगा जिससे डायबिटीज विल बी हैप्पी. हैप्पी स्टेट ऑफ माइंड, हैप्पी स्लीप, हैप्पी फूड, हैप्पी बॉडी मूवमेंट्स एंड हैप्पी सोशल लाइफ. दैट्स इट. है ना, 5 चीजें हैप्पी रहेंगी तो डायबिटीज भी हैप्पी होएगा.
Yes, sir, definitely. And you have covered all the questions that I prepared. Like I prepared around 15 questions और सारे कर लिए. Hello?
I can't hear you, Bilal. Dr. Bilal, I can't hear you.
Can you hear me now?
No, not yet.
Hello?
Yeah, now it's okay.
No? Yeah. Might be the network problem. I think our network is also now bored of us.
It's telling to go home and sleep. It's Sunday. Enjoy your Sunday.
Yeah, but overall it was a very, very, very nice session. मतलब जितना सोचा था उससे ज़्यादा सीखने को मिल गया. And
Thank
I
you.
hope the viewers who are seeing, they also learned a lot. So thank you very much, sir, for your time.
Most welcome, dear.
Now you can
I'll
rest.
take rest. Yeah, I'm very sleepy. I'm very sleepy. Very, very sleepy. But it
Okay,
was my
then
pleasure.
take care
And I'm very
and see you.
happy that I could share my
Yeah,
knowledge
sir.
with you all.
We are also glad to have you here.
Thank you very much, dear.
So thank you very
Welcome.
much. So now you can take rest and we'll see you in upcoming
Sure.
classes, manual therapy, pain science, and everything that you organize.
Sure. Okay, dear. Bye.
Okay, thank you,
Bye.
sir. And thank you, everyone. If you have
Thanks
any
to the
questions, you
viewers.
can just go through the video and ask in the comment section. So see you all.
Good night, everybody.